Hi, I'm Professor Paul Anantambaya, Senior Consultant with the Division of Infectious Disease at the National University Hospital and also Professor of Medicine with NUS Yonglulin School of Medicine. I'm here with Asia One to answer some of the most frequently asked questions on living with COVID-19. We now know that the virus load starts to drop off after about 5 or 6 days, and very few people are still infectious on day 7, 8, 9 and 10. So 10 is being a bit conservative. The second reason is that it's simply not practical to keep well people in hospital or in isolation just waiting for day 10. Looking at the numbers that we get, if we get 1,500, 2,000 cases a day, that's the equivalent of 1.5 large hospitals. So it's just simply not practical to do that. This is a very interesting question because you can recover at multiple levels. Most patients are only sick for 2 or 3 days. In fact, a lot of them are barely sick for a day or two. So theoretically, they're fully recovered clinically on day 3, 4 or 5. But if you want to ask the question as to when they are not contagious, then again, day 7, 8, 9, 10 is probably when that happens. Now, there would be if the vaccine prevented transmission. So like for example, the measles vaccine is compulsory for entry into primary 1 in the mainstream schools in Singapore. But the differentiation is there because the measles vaccine prevents transmission. So it makes perfect medical sense that if you don't want to let your kid get vaccinated, you've got to homeschool the kid. But unfortunately, the COVID-19 vaccines are not quite as powerful as the measles vaccine. So they prevent you from getting severe disease, but they don't prevent you from spreading it to someone else. So the medical justification for keeping you away from a cinema or a restaurant is very hard to justify. So what's the difference between epidemic, pandemic and endemic? That's a very good question. Everything begins with an epidemic. When you have an outbreak of infectious disease and it's above the usual baseline. If an epidemic spreads from one particular country or the adjacent countries all over the world, then it becomes what's known as a pandemic. Every single pandemic disease becomes endemic. So basically what it means is to live with an endemic infectious disease just like we do right now with dengue, with HIV, with tuberculosis, with influenza. These diseases are potentially deadly and they can spread if they're not properly controlled. So what it means to live with endemic COVID-19 is we have a strategy to monitor the disease, to see who gets infected, to protect the vulnerable, to do contact tracing if necessary, and basically to ensure that people can get on with their lives without too much damage to their health and to the well-being of the society. Will masks be a part of our daily lives? And I sincerely hope not. I think masks need to be used in specific situations, like for example in hospitals or on crowded public transport settings when you're afraid of getting infected. In general, I'm hoping that we'll move to the stage where we don't need masks for everything. Well, the bad news is that once an area has been identified as a cluster, it's too late to try and avoid the area. And the point of identifying the area as a cluster is so that if you were there, say 2 or 3 days ago, and then now you develop a fever or running nose, then that's the time to get medical attention. Make sure you get tested, try and isolate yourself away from vulnerable elderly people around you. Do you think everyone would get COVID-19 at least once in their lives since it's so rampant now? And actually I think the answer is yes. In fact, we just did a study with some of the pediatricians. We looked at children, we looked at adolescents, and we looked at adults. And we looked at the seasonal coronaviruses. There are at least 2 or 3 of them. The prevalence of infection in Singaporean adolescents and adults was 94% to 90%. In other words, almost everybody had been infected by one of these seasonal coronaviruses. And I think that's what's eventually going to happen with COVID-19. Now, this actually has to be answered on 2 levels. There's a first claim which is going around by actually someone from Singapore, which argues that Delta emerged as a result of the vaccination, so it's an escape mutant. And that is not true, because we know that Delta appeared even before the first vaccinations were rolled out. The second part of this question is whether people with Delta are actually the ones who are spreading the virus. And unfortunately, that's partly true. Because what the vaccine does is it doesn't prevent you from getting infected, but it prevents you from getting really sick. So previously, if you got infected, you get sick, you stay at home, you go and see the doctor. But now, because you've been vaccinated, you get a really mild illness. You don't think anything about it. You think it's just your usual sinuses. And then you go to work, you go and visit your grandmother, you go and spread the virus to all kinds of other people. But unfortunately, there's this paradox where the vaccine mutes the severity of the illness, so makes it possible to spread. And the answer is yes, in a way. And I think part of the reason is because the current vaccines are version 1.0. All the companies are working on new and improved versions of the vaccine, and we also haven't determined the ideal dose or the ideal route of administration. Right now, there are still going to be a significant number, especially of older people. Despite being fully vaccinated, they may end up getting severely ill and dying. And I think that doesn't mean the vaccines don't work. It just means that we've got to figure out a way to make them work better. In reality, the answer is yes, because the first person in the world who was vaccinated with the COVID-19 vaccine was vaccinated only in December. That's less than 1 year ago. So if anybody tells you the vaccines are safe for 1 year, they're not telling the truth, because nobody has been vaccinated for 1 year. But as we go months and months down the road, we get more and more reassurance that the vaccines are safe. What is happening though is that the immunity is waning a little bit, so they need some booster shots especially for the older individuals. So in theory they're right, but the chances are they're going to end up being wrong. And the answer is, I don't think that boosters will be needed like the flu jab, but I think what's going to happen is that we might need a 3-dose regime. And we know that that's what we do for hepatitis B, for example, where you need a 0, 1 and 6 month dose. Like certain people, when they're traveling, they try and take an accelerated regime. So they do Hep B in 0, 1 and 2 months. And we know it doesn't work that well. So it may be that the 0 and 4 weeks or the 0 and 3 weeks that we've done with the mRNA vaccines, that it may be too short an interval. They may eventually decide on a 0, 1, 6 or maybe even 0 and 6 for the final regime that is going to be used for the COVID vaccines. And I think yes, there is, but this is not unexpected, because when the number of total cases has gone up, then it's likely that the number of deaths and the number of ICU cases will go up. The people who got COVID last year were young, healthy Bangladeshi workers. So the incidence of severe disease and death in them was very low. But if you actually look at the Jurong Safra population, when we had some of these older uncles and aunties, the proportion who died is actually about 20% for those over the age of 80 in 2020. Whereas if you look at this year, for those over the age of 80, the proportion who died is actually 10% or less. So there's actually been an improvement. It's just the absolute number. Again, it depends on whether you're one of those people who worries about the weather report. So it's an individual way you look at life in general. I think what is important is to make sure that you're up to date with your vaccination, especially if you've got vulnerable older people around you. The restrictions really are not going to do very much, because most of the clusters are occurring in households, and they're occurring at workplaces, they're occurring in markets. And these are essential things, you need food, right? You need to go to work for certain essential businesses. So these are very, very difficult to control and to prevent. I think right now, the numbers are so great that there's probably no point in tightening restrictions. And what we need to do is we need to look at what are the things which are most painful. A lot of older people in Singapore live alone. So when they get sick, sometimes it's too late before somebody finds out. And then that's going to have an adverse impact on their health. So if I could lift the restrictions, one of the first I would lift would be on social visits to elderly people, especially those who are living alone. By the time your infection is being detected, you've already had maybe a day or two of symptoms, and you've already exposed your family members. So say you're diagnosed on Friday, you had symptoms say on Wednesday and Thursday. Monday, Tuesday, you already infected your family. So what you want to do is you want to make sure that they are with you, that anyone who's not well gets medical attention as needed. The rest of you all just ride out the illness, stay together as a family, go through a quarantine and maybe have better bonding. If you're not well, go and see a doctor. Don't go to work, don't go and try come around vulnerable people. If you really can, try and find someone who's unvaccinated and persuade them to get vaccinated. Beating them over the head is not going to work. Trying to listen to them, trying to understand what their fears are, and trying to address those concerns, that's going to make a huge impact.